So thank you for being here, and most importantly, thank you for organizing this very good event. I'm very happy that this is happening because it gives us the opportunity of looking at a problem that is much debated in the newspaper, on TV, by journalists, politicians, but hopefully we will look at it from a different angle, I would say a more profound angle, and that is the philosophical angle. Hopefully what we are going to see today is that philosophy can help us to look at issues more profoundly and to make clarity out of complex problems. It is often said that philosophy is not very useful, and that's always the problem that we have as philosophers to justify our existence and to get new lines and to get jobs. Well, today hopefully we will see that philosophy is important, because when you make a life and death decision, like in the case of euthanasia, you need to be clear. You need to know what the problem is, what your options are, and what the challenges are. Without the precision and the accuracy that you get from philosophy, you might be very confused, and you might make a decision that is not fully informed. In my view, the purpose of philosophy is not to give us an ideology, a series of theories, a series of doctrines, is to give us conceptual tools. Tools that we can use, of course, in medical ethics, but in any other situations in life or any other branches of knowledge. So very briefly, I want to show you 3 ways in which philosophy does help us a great deal in the case of euthanasia, but it can help us also in other cases. Remember, the purpose of philosophy, at least in my view, is not to give the right answer, is to have the good way of thinking about the question. Answer is always something that it's bound to be personal and subjective, and it's okay to disagree about solutions. The important thing is that when we speak and when we debate, we do it rigorously. So few examples. One way in which philosophy does help us is with logical rigor. The other way in which philosophy helps us is to create conceptual clarifications. And the third way in which philosophy helps us is that it helps us to get to the foundation, to the bottom of the issue. I'll give you a few examples of each. Let's start with logical rigor. One very common card that is played in the debate of euthanasia, and it is played even more recently in, I think, the debate for Obamacare, is the Nazi card. Well, the Nazi had some form of euthanasia. The Nazi, of course, are bad, thus euthanasia is bad. This is a very good example of a bad argument. It's a logical fallacy which is called argument ad hominem. According to this fallacy, an argument is true or false, not because of its reason, not because of its argument, but because of the person who utters the argument. We all know a very good version of this argument because we were all teenagers. All that our parents said was wrong, not because what they said was wrong, but because they said it. And now we all know that, of course, they were right. There is actually a joke in, I don't know if it exists in English, it is in Italian. When you are a teenager, you always say, oh, my parents are always wrong. Then when you get to your 30s, you say, oh my gosh, I should have listened to my parents. So that's the idea of an argument ad hominem. So you reject a view just because people that are bad had it. But sometimes bad people might hold good arguments. Another example, and we'll see more of this today, is conceptual clarification. In the debate you will see that euthanasia is a general term. It actually comes from the Greek, from 2 Greek words, thanatos. Thanatos means death. It's supposed to mean good death, and we use it as a good way of facilitating or helping people to die. But euthanasia is a kind of bigger category which involves several different types of ending of life. There is voluntary euthanasia, involuntary euthanasia, active, passive, suicide, assisted suicide. We might go through some of them, but all these distinctions are important because they help us once again to clarify what we are talking about and the different situations we are focusing on. For me, the most crucial contribution of philosophy is in the matter of the domain of the debate. A very common debate that you hear today is that if euthanasia is going to be legalized, it will be abused. Some old, weak, disadvantaged people will be pressured to end their life. Now here the idea is that euthanasia is wrong. Why? Because it will be abused. This is a very good example of a great conceptual mistake, of a conceptual confusion. The question, is euthanasia acceptable, is a question that has to do with the value of life, the understanding of suffering, and other related issues. The issue of whether euthanasia is going to be abused is a question of how euthanasia is going to be enforced. So the first one is a purely philosophical or moral question. Is it acceptable to end a life? The other one is a more political, legal question, how to take steps in order to make sure that euthanasia is not abused. So as you can see, when you have debates, I actually was looking at some debates on YouTube, and some people had as an argument against euthanasia the fact that euthanasia is going to be abused. That's a bad argument because you're focusing on problems of enforcing rather than of a core issue. The core issue is whether it is acceptable or not to end a life, and eventually under which circumstances. So as you can see, it's a debate of euthanasia that has, of course, medical, political, legal implications. But as a philosopher, the most important thing is to go to the root and to distinguish all these different, we can call it, facets of the issue. Because if you don't distinguish the different facets of the issue, then you get a lot of confusion, a poor debate, and possibly poor outcomes. Now, what is the important of the foundation of asking a question that is very, very basic? That's important, and that is what philosophy does most of all, because what philosophy ultimately is the discipline that presupposes all the other disciplines. When you do science, economics, medicine, you proceed assuming a lot of things. For instance, you cannot do physics without assuming that there are laws in the universe. But how do you know that there are laws in the universe? Well, that's a philosophical question. Another example. If you study economics, the big issue, if you study the economics of a country, for instance, is wealth. But yet again, the question is, what is wealth? Can we equate wealth only with material possession? Or is wealth also quality of life, education that people might have, capacity to appreciate beauty or art? If you look at it in this way, you see that the foundation question is the most important one. And it's interesting that today, many economists are realizing that you cannot simply look at the well-being of a country by focusing on how much money people earn or how much possession they have. It's important also to care about other things, such as quality of life, education, and others. So you see, with philosophy, you get really to the bottom line. Now, what is, at least in my view, the bottom line in the case of a debate of euthanasia? It's a very simple question. What is life? Before we can decide whether or how or in which condition life can be terminated, we have first to agree about what is a human life. What is our life? What makes our life worth living? A lot of the debate on euthanasia focuses on suffering. And the argument is we don't want people to suffer unnecessarily, we don't want people to suffer too much. And that is definitely a very real consideration. But I think we can go even deeper and ask the question, what makes a human life as opposed to the life of an insect or an animal or an object? Is simply being alive, simply breathing and digesting food what makes us human? Or it is something more? Again, I'm not giving the answer because I don't think the goal of philosophy is to give an answer, but I'm pointing to the direction at which we can start to have a good and informed discussion on this question. So now I'm going to pass the word to the first side of the debate, and then we'll take it from there.
So we're debating pro-euthanasia. So the approach that we decided to take was a principle-based approach where we create a working definition of our topic and apply that to specific situations. So in this case, we're creating a working definition for both euthanasia and for what it means to be a human being. And then we'll apply these definitions into specific situations that we propose. So firstly, euthanasia or active euthanasia, or a specific example as physician-assisted suicide, is where the physician gives the patient medicine and which is lethal to them. And the assumption is that the patient is in pain and terminally ill, and he asks the physician to assist in killing himself. And the patient is, of course, in a rational state of mind. So we also define killing, murder, and death. So killing is taking a life, whether it's yours or someone else's, or allowing death to happen, while murder is taking the life of someone who wants to live against their will. And then death itself is a natural biological process that comes with life and therefore must be accepted as natural. So with the right to life is the right to death. And to this end, death is not inherently good or bad, it's just a part of life. And the role of the physician is to act in the best interest of the patient while accepting that the patient has self-determination, which means that the patient can make their own decision.
I think the next aspect that we want to address is, as Dr. Kazan said, what it means to be a human being and what a human life really means and how it differentiates from that of animals. And to do this, I think that it's appropriate to turn to some of our philosophers and base our definition off of their explanations and their moral codes. So to do this, we're going to use Friedrich Nietzsche and John Stuart Mill's arguments or theories. And Nietzsche believes that what defines a human being is someone who has the will to have power and to survive. So this will is essentially, it's a will to survival. And in the case of euthanasia, this person lacks that will for survival. Mills starts by bringing distinction between human beings and animals. And he discusses it in terms of happiness. And he says that animals have the ability to feel physical pain or physical pleasure, whereas human beings have the ability to feel both physical and mental or emotional pain and pleasure. And naturally, a human being wants to put himself into the position of happiness, or a position of being able to feel pleasure, or at the very least he wants to remove himself from feeling pain. And that's essentially, to remove himself from feeling pain would be an achievable happiness. So in the case of euthanasia, being able to remove himself from whatever physical pain he's feeling would be his means of achieving happiness at that time.
Okay, so we're going to start off by talking about our definitions and the conditions of what it means, the human condition. We have adopted the philosophy of a man named Terzani, who said that if we are to recognize the sanctity and or the distinction and dignity of human life, we have to recognize the sanctity and dignity and distinction of every human life, and we add in every capacity and condition. Coming from that, what it means to be human, we have taken the viewpoint most similar to Immanuel Kant, being that humans have goodwill. What he says is goodwill is our power of rational and moral choice. It's only found in humans, and it is unconditionally good. Happiness, as Immanuel Kant and we hold, is something that is subjective and individual to each and every person. We are going by much more of an absolutist approach, discussing things that we have termed unconditionally good or bad. Our goodwill that is distinct only and found in humans, and the human condition is unconditionally good. Coming from that, their definition of killing, as it was defined, is taking a life or allowing death to happen, right? Is in of itself unconditionally bad. Taking somebody else's life, despite, in terms, when talking about euthanasia, despite the fact that the end result might be positive in that it relieves or may help to relieve the suffering, whether it be physical, psychological, and both, perhaps both physical and psychological, of the patient, despite the fact that the end is good, the means to getting there is not. You cannot use immoral means to achieve what is deemed as a moral end, which is why we retain that killing, even in their definition, is immoral and cannot be allowed to achieve any means, because in and of itself it is inherently bad. Yeah.
So I think what the next thing we need to address is what is killing, and is killing something that's morally right, or is killing something that's morally wrong? To test whether something is moral, we need to formulate a test to test it. So what we have is Kant's morality test, and it has to pass two tests. So the first one is the contradiction in conception. You start off with a maxim. Let's say our maxim is killing is right. Or for example, let's go with stealing is right. How does that maxim work if everyone would abide by that maxim? So let's say stealing is right, and we all go and steal. But the assumption to steal would be that you own something. But if everyone is stealing, then no one owns anything. And if no one owns anything, you can't steal. So in it itself, it's self-contradictory. So that cannot be a maxim. Another example would be killing. Does killing pass the first maxim? Well, first let's look at the second maxim and see if we can pass that also. The second maxim would be contradiction in will, because if you pass the first maxim, which some people say killing would, can it pass the second maxim? The second maxim is called the contradiction in will, but also the self-contradictory maxim. Is it possible to universalize something? Some unpleasant thing, let's say helping someone in need. Can you universalize that and be okay with it? Would you want to live in a world that's governed by that? Sure, someone comes to you for help and you tell them, I can't help you, but would you want to live in a world where you need help and someone doesn't help you? No, it's self-contradictory. It's self-contradictory and cannot be universalized, and therefore it does not pass that test, and that maxim fails. So when we come to killing, ask yourselves, would you want to live in a world where everyone can kill? If everyone can kill, what does life mean? In order to kill, you assume that someone has life to take. So we see that killing isn't moral because it cannot pass these two tests and therefore cannot be a maxim. I can kill. That cannot be a maxim. Killing is wrong can be a maxim. And this not being a moral, what are the reasons we do things? We do things because we think something is moral. Maybe it brings us happiness, or maybe we can reason it out. And they brought up happiness as part of their argument. But can happiness be really something that you can define morals on or reason? Because happiness is subjective. What I think is happy is not what all of you think is happy. But what can be used to determine morals and whether or not killing is right, which is the fundamental question here, with taking the life of a patient, is reason. So instead of using happiness, we will be using reason and morals to determine our argument.
So,
Sorry, before you go ahead, I just want to remind the audience what we're going through, so it's easy for them to follow. So we have two sides of a debate, and as you can see, the focus is really on a definition, more specifically, definition of what it is to be a human being, and what is the definition of taking a life away. And this is exactly what I was suggesting in the introduction, that we are going to the fundamental elements of the debate, and from these fundamental elements we can move forward. Yet, of course, there is disagreement, and now we are going to develop these differences further.
So when we brought up the topic of happiness, we were simply saying that happiness is the absence of pain and the ultimate goal of life is to achieve happiness. With that said, morality is not necessarily determined by happiness, so reason is obviously a huge part of morality. As a result, a patient must be in their right mind and must be able to reason in order to make the decision to want physician-assisted suicide. Also, they brought up the topic of killing and how killing is always universally bad. Well, in the case of self-defense, can we really say that killing is bad? If it's saving another life, I mean, how do you take something so absolute and then say that, well, even in the case of self-defense, killing is bad? And in Western society, we often take legality and morality in the same terms. So if legality determines morality to a certain extent, then if killing is always bad, why are people that are killed in self-defense, why are their killers not persecuted in law?
I'd also like to comment on how you described human life in terms of dignity. And you mentioned that by killing a person, you're essentially, or through euthanasia, you're removing them of their dignity. And there was actually a court case about this in Montana, Baxter versus Montana. And it was this exact case of a patient was in pain and she wanted to die with dignity. So she asked her doctor for aid. And the court ruled, and I will quote, "Constitutional rights of individual privacy and human dignity taken together encompass the right of the competent, terminally ill patient to die with dignity." So said Judge Dorothy McCarter. In other words, there may be no law in the Constitution prohibiting, there may be no right in the Constitution to death, but it's inherent in your right to live. Because naturally, scientifically, part of life is death. And by being born, you have to accept that. And according to this, part of dignity is for the patient to decide that he wants to die, or she wants to die in comfort, in least painful and least harmful way. The next thing I also want to comment on is your idea of immoral. And for something to be considered immoral, it has to promote harm. So I'd like to pose a counter-argument. If you let this patient who's terminally ill live, instead of letting him die, you're actually causing him more pain. Wouldn't that be considered immoral?
Okay, so let's move to the counter-objections.
Sure. Okay. Our problem is not so much with happiness, but in the way that you used happiness. You said that happiness was the distinction between, in a sort of Mill's type of philosophy, that you define happiness as the absence of pain, and that happiness is and our ability to interpret happiness is what makes human life distinct from animal life, correct? So our problem is with the subjectivity of happiness, how that it varies from one person to the next. Your definition of happiness being that it is the absence of pain is one of the many definitions. We retain that it's reason that we want to use to establish our argument. In terms of self-defense, killing someone in self-defense is still wrong. We want to make the distinction between the circumstantial outcome and the actual act. The act in and of itself of killing or murder is wrong, and it is always wrong. The fact that you kill somebody else in self-defense and save the life of somebody else, the outcome is good. However, the way that you achieve that outcome is still through immoral means. Now, in the court of law, not all the time is somebody who kills somebody in self-defense is convicted and sent to jail, but that is the court system. the act of killing is still wrong. The circumstances, or perhaps the outcomes, may be moral, or may have a more positive outcome. The act in of itself, we retain, is still immoral. To clarify our definition, when we said dignity of human life, we meant, by dignity and sanctity, we meant more the distinction between human life and that of other life, like animal life. By dignity, we were talking about the distinction that we hold, the esteem that we hold human life in compared to other lives. Not so much the condition of the life, such as when you're talking about euthanasia and dying with dignity. It's not that type of dignity. It's dignity in terms of distinction. Okay. Yeah.
On the dignity note, you said that, you asked us a question, doesn't the patient deserve to die with dignity? Well, in order to answer that, we have to define what's happening here. What's happening is we're killing the patient. What kind of killing is it? The patient is really committing suicide because the patient is willing to die. He's not dying unwillingly, unintentionally, by some malicious act. But what kind of suicide is it? Does he deserve to die with dignity? Yes. If he wants to die, he can die. He doesn't have to stay living. And that's a self-related suicide. But what we're talking about over here is a socially related suicide. When you're involving other people, when you're involving the physician, now you're bringing someone else into this. Someone else who has to make a decision. And Dr. Donato touched upon this a little bit. He talked about the slippery slope. And while that's not a philosophical debate, it's most certainly an ethical debate and something that's relevant in medical practice. Let's say for argument's sake we say euthanasia is okay. Let's say euthanasia is case A. And that's philosophically ethical. But what can euthanasia lead to? What if it leads to something that we can all agree, both sides, is not philosophically okay, ethically okay? What if it leads to involuntary euthanasia? What if it leads to people getting coerced into wanting to die, wanting to get the pills? How can we regulate that? Is it really possible to regulate who says what to who? If I go over to a patient and start talking to him and say, listen, you're kind of a burden, costs a lot of money to keep you alive, you're kind of pressuring him into dying. How can you regulate that? You can't regulate that. So if you can't regulate that, you can't bring in euthanasia. And by making it a socially related suicide, the entire concept of the patient has a right to die doesn't even apply here, because it's not just the patient who's involved, it's the physician and other people who care about the patient as well.
I actually just want to answer their last posed question, because I don't think we directly touched upon that, and that was I believe Marion proposed that isn't allowing the patient to suffer, doesn't. So it was addressing the idea of being immoral, and that something immoral has to promote harm, I think is what you said. Okay, so, and then the question posed was, allowing the patient to continue suffering is promoting harm. So, in terms of our distinction, wrong is in absolute and not subject to gradation. Killing a person, even though it is relieving their suffering, we retain is still wrong. Like we have said, it is still an immoral means to perhaps a more moral end. Allowing the person to suffer is a difficult and almost different question. It is not the physician's fault or purpose or doing that the patient is suffering. Yes, the physician has to take care of the person, but allowing the patient to continue suffering, it hasn't been caused by the physician. So, in terms of the physician's culpability in that sense of the question, it is, well, it can't be more wrong, but it is wrong to take the life of the patient. Allowing the patient to suffer is not the direct fault of the physician.
And I think there was just one more thing I wanted to bring up regards to involuntary euthanasia, the difference between voluntary and involuntary. Voluntary would be the patient willingly asking the doctor, can you help me die? Can you give me the pills? Whereas involuntary euthanasia would be the patient being coerced and thinking he wants to die and asking for the pills, which can be very subtle. And why this is important is that doctors as we said, doctors get involved in this. It's a socially related suicide. So there was actually a 1998 study brought that said doctors who practice cost-effective medicine, who are cost-conscious, who are trying to save resources, are more likely to prescribe terminally ill patients with drugs that can help them die. So now they're bringing the doctors into this. If it's shown that doctors would actually prescribe them those pills when they don't actually believe that the patient has the right to die, or they're not doing it because the patient asked, but because they want to save resources, because this person is terminally ill, then that, once again, erases kind of the whole, what the patient has the right to die approach, because you're bringing the physician into this.
So, I guess first we'll look at the situation from the point of view of the physician, and the physician is not making the decision for the patient. So the job of a doctor is to fulfill the patient's best interests. As a result, if the physician sees that the only way for a patient to live is in agonizing pain and the patient wants to end their life, who is the doctor to stand in the way? So it should not be morally wrong for a physician to help a patient get to a better place, even if it means death. Well, you guys said that if doctors can force involuntary euthanasia at some point. Well, there are 3 states that currently have legislation that allow physician-assisted suicide, and in all 3 pieces of legislation, there are certain guidelines that have to be fulfilled in order for physician-assisted suicide to even be possible. So firstly, the patient has to be in a severe condition in which it's terminal, they have a terminal illness, and they voluntarily express their want to be killed. And then they have to have a psychologist come in and say that they are in their right mind to make this decision. And then lastly, there has to be 2 physicians, not just one, that say that there's no other way for the person to be relieved of the pain. And at that point, physician-assisted suicide is legal in these specific states. So even if he says that it's possible for involuntary euthanasia to occur, there are guidelines that are very strict that basically there's a very strict step-by-step approach to this. And we also have a court system that if a physician decides to take something into their own hands and do involuntary euthanasia, they can be prosecuted for that.
We would like to note that it is interesting to state 46 out of the 50 states say that euthanasia is illegal. We cite here Cesare Beccaria, who was an 18th century philosopher who wrote that the laws, in his view, of a society is the summation of the rights of man. He actually, a little more background, he was writing against the death penalty, but in many ways what he is written here is applicable to our debate. So once again, he said the laws are the summation of the rights of a man in society, and therefore it is unthinkable to give any one man the right or the ability to ask or take the life of another. Seeing that 46 out of 50 states in the United States of America say that euthanasia is illegal, and that it is not and is illegal to be practiced in any one of those states, is a hint to what perhaps not only the American people but the American legal system consider, if we were taking this on a little more of a legal side of an argument, what American people and the American legislation consider the rights of people to be. And one of those rights does not include euthanasia, does not include killing. I don't know if there's anything you want to.
And also, what about the states that do say it's legal? There are 4 states that currently say it's legal. And in one of those states, in Oregon, there was an interesting statistic that I found that said 66% of cases for patients who requested physician-assisted suicide asked because they felt they were being a burden on those around them, on the fact that it was costing their family so much money and on the fact that it was costing their family and friends so much pain to see them suffer. So we talked about pressures that outside people can bring, but what about the pressures you yourself can bring? Do you really want to die? No, you don't. You really just don't want to be a burden on other people. So how are we to determine what the patient's best interest is if the patient doesn't know what his best interest is? How are we physicians supposed to say, well, we'll bring in 2 people and then we'll be able to determine whether or not he really wants to die when there are all these outside pressures? What if both physicians are cost-conscious physicians? Are you going to bring in 3? What if 3 are cost-conscious physicians? Are you going to bring in 4? It's just a never-ending loop. So what we're really saying is there is no way to regulate this. You cannot follow every single person. You cannot see what everyone is thinking, talking, saying it all the time. So,
sorry, before you go ahead, just to clarify the debate. So, as you can see, there are several issues, and let's try to see how they are related. There is a foundational issue, overall the foundational issues about life, what is life, the definition of life. Connected with the definition of life, we have a definition of happiness, dignity, and of course death. Now you can hold any view about these foundational issues, irrespective of what follows later. You can be in favor of euthanasia, but then it comes the issue that it has been raised right now about the enforcement of euthanasia. And you can go both ways. You can say, well, in principle, I think that, for instance, if suffering is too much, euthanasia should be allowed. Yet, I'm not going to make it legal, I'm not going to make it into a law, because I don't think that it is possible to be enforced. When we look at the issue of enforcement, however, we have to be careful, because whatever law you create, there is always the issue of enforcing. There is always the problem in the case of a teacher that he gives the grade because he finds a student more interesting than another one. So he's not going to be really objective, but he's going based on his sympathy. How do you police that? In politics, we have to realize that the issue of enforcement is a complex one, because there is going to be, in principle, always possibility of abuse, whatever law we implement. And then it brings us the issue of the more, instead of the legal side, the more the political side, which plays into the debate of the states, or more general, of countries. There are countries in Europe, like Holland, where euthanasia is, for instance, allowed. And that is really, then comes to our views of politics. And if we believe in a democratic system, then ultimately what the people decide or vote, whatever system, whether it's a referendum, whether it's something else, it should be the ultimate decision the ultimate decision process. So if ultimately we live in a state where the people are more conservative or more liberal and they decide one way or another, then we have to rest with that. But these are the different elements. So as you move through the debates, do appreciate the complexity of the different elements and how, in a way, philosophy is required at all levels, but mostly at a fundamental level. Sorry.
Thank you. I think that, yes, there's always going to be some extent of abuse in a law, no matter what it is. There are people who murdered people and who haven't been caught, and they're still running wild somewhere in the US. But at the same time, we do have laws for a reason, and that's because, for the most part, they're there to help the people. And the wording of these court rulings are very specific, so as to limit the abuse of any such manipulation of the rules. And I'll read to you, I'm going to read to you the court ruling from Oregon, which says that an adult who is capable, is a resident of Oregon, and has been determined by the attending physician and consulting physician to be suffering from a terminal disease, and who has voluntarily expressed his or her wish to die, may make a written request for medication for the purpose of ending his or her life in a humane and dignified manner. And this really discusses the patient's state of mind, not the family members, not really people who may be persuading the patient to do anything in any sort of way. And in and of itself, it acts as its own set of checks and balances. So within the government, we have checks and balances in the executive branch, legislative branch, Congress, so to speak. and so on. And this can act as a system of checks and balances for where we let, or to what extent we let euthanasia go to, and in what case it is permissible and what case it's not.
I'd also like to add that in your statistic that 66% of patients wanted to end their life because they felt that they were a burden on others, I don't know what percentage of those were allowed to be part of physician-assisted suicide, but according to our research, if a psychologist doesn't think that the person wants to die because of their pain and suffering, then the state won't allow the physician to euthanize them. So, I mean, you can have as many people as you want say that they want to die because they're a burden on their families, but whether or not that's going to be allowed is a completely different question.
Taking the taking a legislative approach to euthanasia and saying if there was, besides the state that it's already, the states that it's already allowed to be practiced in, if euthanasia hypothetically was allowed to be practiced, we find problem with the potential of the direction in which euthanasia could go. We cite, as an example, the genetic revolution that we've seen in the past 60 years. In 1951, when Watson and Crick cracked the genetic dilemma of the structure of DNA, no one could have imagined this novel field's degree and direction. In the wake of the all-encompassing and comprehensive human genomics project completed in the last 20 years, it's now possible to do complete and total prenatal genomic testing on an unborn baby, on a fetus, in order to determine the possibility of such diseases such as diabetes, as well as, in the past 10 years, the ability to predict the possibility, probabilities, because genetics is largely probabilities, of such things, including the possibility of early onset balding for the unborn child. Such superfluous information not only burdens the expecting parent, but is a direct result of lack of regulation and direction, and clearly overstep boundaries in this novel field that is as alarming as it is detrimental. We cite the explosive evolution of this novel field in science, born 60 years ago. In the same way, we find problems with the potential of euthanasia, as it is a novel form of treatment in medicine. As we've seen with genetics, the unregulation, lack of regulation, or the inability to regulate effectively in the time that this field has grown has caused some detrimental effects, and we would not want the same thing to happen with euthanasia, despite the attempts, just as there has been many attempts in genomics to regulate efficiently such a field of medicine.
For a couple of things you said, I want to bring in some practical arguments to maybe counter them. First of all, you said the patient is suffering. Well, if the patient is suffering, and that would be a reason to terminate the life, an easy way to get around that, specifically since euthanasia has so many bad side effects, where it could lead down the road, would be palliative care, which is making sure the patient is comfortable in their last however long they have. So if you can eliminate the suffering, then why would you want to open the doors for something that could be so bad down the line? And another thing I wanted to bring up was, you said you brought in a psychologist now. You had 2 doctors and a psychologist. Well, we've all been to the doctors before, and they told us we had one thing, and what if we had something else? What if the doctor misdiagnoses them? But in this case, instead of them telling you you have the flu instead of a fever, now they're telling you you're dead instead of alive. So the consequences for a misdiagnosis are much bigger here. What if the psychologist comes in and tells them, all right, he's rational, he knows what he's talking about. Don't you need a second opinion? It's just never going to end.
Okay, so Firstly, we'd just like to say that there are certain conditions where suffering cannot be eliminated no matter what hospice you go to. For example, just off the top of my head, multiple sclerosis is a condition where it's degenerative and there's nothing you can do about it, and it gets to a certain point where no amount of morphine will end your pain. That's just the condition. So we're saying that euthanasia should be a last resort. So if there's a way for the patient to get help by going to a hospice and getting their pain relief there, then euthanasia shouldn't really be an option there. It's only for cases such as multiple sclerosis where at the end there's no way to help the pain.
You also brought in genetic testing, and I think that there's a very fundamental difference between genetic testing and euthanasia, which is the issue at hand. And that is that at the start of genetic testing, there was no limit as to how far it can go. And researchers continue doing research and pushing it as far as they could. And in many cases that was good, and in other cases it wasn't as good, as you brought up, ethical issues regarding genetic testing. And I think that that's why it's important that in the states and countries, because there are several countries in which euthanasia is legal, there's a system of checks and balances put in place preceding this legalization of euthanasia. And in that sense, we can limit the amount of abuse down